Hey guys, welcome back to Susan Shares. Well, I've got Steve with me again. Hey Steve.
Morning.
So glad to always have Steve with us. And so Steve, I brought him along today to give us a medical update, and I'm going to tag team with him in just a minute. So Steve, give us a medical update. And it's just been 2 weeks, I think, since you were with us.
Well, there's lots happening. You can't get away from hearing about COVID-19, the coronavirus. And so I think basically the message I'd have for people will be pretty redundant. Washing your hands, cleaning surfaces. I really think we need to kind of double down on our social distancing. Don't laxen your attitude about that. If you've been a little lax about it, tighten up. You hear more and more reported cases. We have more cities around the United States that are considered, hot spots. Detroit and I think New Orleans is getting more active in the number of cases they're seeing, in addition to New York City and California and Washington State. So, it is spreading, but I think also some of those numbers, as some of you probably might argue or are aware of, it's a relation of having more testing done, so we're just better aware of what's out there. But either way you look at it, this is a deadly virus. It's more deadly than the common flu. We don't have nearly as many cases around the country, at least that we know about, as we do the common flu. But it's probably at best, or at least 10 times the mortality rate, plus the morbidity with it. I mean, here's the unique thing about this virus is that you might get exposed to it. It's usually on average about 5 days before you might have symptoms if you're going to. About a week later, suddenly your lungs quit working. If you're going to be one of those prone to that. And so those that are older with chronic disease are more likely to have that sort of scenario. However, even millennials, picking that age group, 25 to 55 or whatever that might be, there's still 20% of that group that requires hospitalization that get it. So they're going to tolerate it a little bit better, but they're still going to get very sick with it. And so the suddenness of the respiratory or lung problems that occur with it, and then the severity of it over an extended time. You might be seeing on reports where people that have to be on the ventilator for a couple of weeks. So I know many hospital healthcare systems, Mercy's no exception, are really doing all we can to plan for having a larger number of patients in the hospital, not only because there might be more of them, but because they're going to require being in the hospital longer. So that kind of doubly adds to taking up our bed capacity. And so our healthcare workers are a little apprehensive about having a lot of patients showing up at one time, but we're trying to be as prepared for it as we can. So my thanks to all of my fellow co-workers, and that's not only doctors and nurses and advanced practitioners and physicians assistants, but it's all the people that are making the supplies available and cleaning the rooms and checking people in and answering telephone calls, and all of the technology people that are now putting together how we can do so much better with telephone visits and video visits and all the things that we're trying to do to keep everyone safe but also provide good care. So all those things are going on, and then a real vigilance that we have to pay as healthcare providers is all the other illnesses that would be occurring if COVID-19 weren't here. We still have to keep our antennas up and stay sharp, and we want everyone to know that we're ready for you no matter what the issue is. So we appreciate everyone's diligence. We would just ask everyone to stay that way, and like I said, kind of double down on the social distancing. And so we see outside of our kitchen window people riding bicycles and walking as families, and we saw 3 couples the other day. The couples standing beside each other, but they're all distanced from each other. So yes, enjoy the beautiful spring, but distance yourself and again, thanks everyone for paying attention to that.
Well, I really appreciate that update. We were doing it especially because we do see everyone out. It just needs that reminder because it's sometimes a false sense of security when it's so beautiful outside and everyone's out. Outside, you think, oh, everything is just fine. I can get out now, and perhaps you're thinking that, and it is true. We do need to get outside and walk and exercise and everything, but also at this time be mindful. We're certainly not through this yet,
No.
and we have to be very, very careful and wash our hands, social distancing, stay in if at all possible. If you have a pre-existing condition, for sure, but to help prevent the spread of anything, it's very wise to do the wise thing. I guess is the best way to put that because it's very, very serious.
Yes, it is.
And we need to take it that way. One of the issues that has come up, especially on my end, and I know yours as well, but that people have texted in, emailed about, called, is, my anxiety tends to come up. I never feel like I've ever had anxiety before. Is this considered anxiety when I feel XYZ? And the issue of anxiety generally is that everyone in the world has anxiety. It's just kind of what level do you have, but at some form we all do have it. But if you didn't think you ever had it before, it might have come to play at times like this when the world, and when you turn on the TV, every time any social media anywhere, but it's all around us right now because everything's closing and no gatherings, that during the pandemic that definitely it would come to play. Or if you knew that you already had anxiety, it may be definitely banked up. So anxiety, what is anxiety and how do I deal with it? And one general statement that I will make is generally anxiety does live in the future. And what that means is that lives in a what if world, So what if I die? What if my children die? What if my husband dies? What if I go bankrupt because my business is died? What if I have gone bankrupt and what if? You live in the what if world, and that can paralyze you. I mean, literally paralyze, and you can't make the next move. You can't make the next decision. You can't, and it comes out in ways that it affects your behavior towards you're yelling at your children, you're yelling at your husband you've never done before, or the opposite, you go to bed, you pull the cover over your head and you can't get out, or you start eating everything in your house, or you don't eat anything, or it affects behavior in such a way. And so you need to realize that anxiety lives in the future, and here's the deal about the future. We can't control one thing about the future. And as in the spiritual realm, that's where we literally, that verse comes into play immediately to me, 1 Peter 5:7, where God literally says the words, cast your anxiety upon me because I care for you, which is not a verse in the Bible about passivity. It is so active. We literally have to do this thing that we have to go, because he's not shocked by anything like, God, I don't know how to do that. I don't know how to, if I'm bankrupt, I don't know what I'm supposed to do by actively, but you have to verbally say, I don't know what I'm doing. I don't know what my next step is, but I'm going to do this. And then if you've never asked for help before, like the second week of Susan Shares, you remember we were given a resource called HARK, that I may have to reach out for HARK and call and say, I've never made a phone call like this before. Can you guide me through how to help practically my family? And yes, they can. That was on week 2 if you need that resource. Or maybe I need to go because they're helping churches. We generally go to our church if we attend a church, but if they can't, they're helping churches. There's some churches that are signed up with HARK, and there are some that HARK can help you. HARK, HARK, Northwest Arkansas, and that's on week 2 of Susan.
HARK.
Yes, HARK.
Okay.
But it's on the second week of Susan Shares. I've got all the information if you didn't catch it. Oh, well, when I say second week, it's like a week ago. So just back up and you'll see all the resources of HARC. And just, you literally get on that website. It was after the first medical information piece that Steve and I did. Steve did all of it. And then the second, Susan shares after that, has got all of HARC's information. And
one of the things about the what ifs
Yes.
in tomorrow is it makes today less effective.
It definitely.
Yeah,
You
'cause
can't do anything.
That's right, because if you're kind of tied up in tomorrow, and Scripture talks about sufficient or today's problems, and so kind of really focus on the present and now. It's not like you can't plan. You need to be planning for some things, but you don't need to be trying to get too far out in the future and being worried about what's going to happen. Take care of those things right in front of you.
Yes.
Depend on the Lord for tomorrow. Easier said than done. And there are a lot of people outside all the medical madness that's going on is a lot of the business difficulties that so many are having. So our hearts go out to folks that aren't working right now, aren't bringing in a paycheck.
Yes.
Their business is shut down. It's trying times in lots of ways, and for parents that are at home and have kids, and that's putting stress on them, maybe trying to work, or just things are tense, and trying to keep everyone happy at home is difficult. So
Very practical
yeah,
things.
so we're not trying to downplay any one little thing at all.
No.
But just realize, it's okay, it's real to have those feelings, but kind of focus on today. Don't
Yes.
get too far into tomorrow.
Not too far, but because Steve is exactly right. If you're anxious, that's so normal. And if you're afraid, no, of course you are. We're in unprecedented times. Who wouldn't be? And to validate those feelings, and that's another thing. Whether you have someone to talk to about that, a friend, you want somebody to say, yes, of course, I validate you being afraid. You want somebody to say that back to you, and then peel that back away. Like, let's talk about being afraid. Let's talk about being anxious. Let's talk about being fearful. Let's talk about that. And then at that point, that's when, because God understands that too. Again, you can't shock God, but you don't want to live in fear.
Yeah.
Because then that's what Steve was saying, paralyzes you. But because God lives in the present with you.
Yeah.
He's there with you. He lives in the present.
So I might say, I've asked you to double down on social distancing, but you might double up on reaching out to people. So if you feel stuck or stymied, reach out to someone. Or if you think someone might be stuck or stymied, reach out to them. A telephone call, a FaceTime. We've got all sorts of wonderful ways to communicate with people these days, and so we need to use them now more than ever. And I think that would be extremely helpful on both sides. It's going to make you feel better if you reach out. It's going to make you feel better if you've been reached out to. So don't miss an opportunity to do that.
Yeah, because that lowers anxiety too. If I reach out to a friend and say, I'm so anxious or I'm so fearful, and they're saying it, I am too, I hear you, I am too. Both lower their anxiety on that. So it's so helpful. You've got to reach out to somebody. You've got to be heard. They've got to be heard. That lowers anxiety. But you've got to reach out, just like we're saying. Because isolation brings anxiety on ourselves. When we isolate, we don't reach out at all. Then you're going to be in that what if world. And that's going to isolate you. So we've got to talk it out. We've got to be in it together. I see these commercials. We're in it together. It's so true. We're in it together. So I hope the update helped you, and I hope just the conversation we're having, that everything's normal, that you're going through. If you told me anything, I'd go, yeah, yeah, you're right. That's so normal. It's so typical, and during times like this. But because they're unprecedented and unknown, and it brings doubt and fear. But what we do with that doubt and fear, our response to it, is so vitally. We're in control of some things, but the other things that we're not in control, we've got to do something healthy with, and be mindful of that. and just staying in the bed under the cover, that's in an unhealthy category.
Right.
So I hope the conversation that we're having, I know we're not curing anything, but we're having a conversation that I hope you can relate to. Okay. Have a great day. We love you. Bye.
Bye.